All right, guys, so we are going to lecture on chapter 15, Pharmacology. Make sure I'm sharing my screen here. Give me just 1 second. All right, that's better. All right, so you should be able to see my screen. So we're going to lecture over pharmacology. So in dentistry, the dental assistant is going to have some knowledge about pharmacology. We need to know the side effects of the drugs, the interaction that takes place when there's more than one drug that you're using. But basically, a drug is a substance that can change life process within the body. So let me say that one more time. A drug is a substance that can change life processes within the body. I would know that definition. Medicines, know the difference between drugs and medicines. Medicines are drugs that are used to treat people. So a drug can be legal or illegal, but medicines are drugs that are used to treat a specific purpose. So when a drug causes an unintended results, like something happens that we don't anticipate or we don't want to happen, that's called a side effect. So you've heard on the commercials on TV saying, oh, yes, you can take this. It does this, 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 and this. But some side effects might be blah, blah, blah. And they list off like this whole long explanation of what those side effects can be. Even if they give that specific drug to 500,000 people and one person has some sort of reaction to it, even if they don't know if it actually came from that medicine, like they can't for sure identify it, they still have to list it as a possibility. They have to list it on the warning label, basically. Drug interactions can occur when one drug changes the effect of another drug. So it can accelerate it or it can cancel it out, meaning it can make it much worse or it can make it not work at all. It's completely pointless. So we have to be aware of that. And so pharmacists go to school. They have all these things put in place. They enter the information into a computer to make sure that there's no interactions, because you can always miss one. So there's many safeguards in place to make sure when we're filling it. So if we make a mistake and we send it in and they're taking other medications, hopefully the pharmacist will catch it and say, hey, this is a possible interaction, and then they'll contact our office. Sometimes, well, in dentistry, we will definitely run into people who are drug seekers. They will come in, complain of having tooth pain, or, that they need this or that done. And then they're going to say these types of things will happen. They'll come in, they will appear very nervous or kind of like very matter of fact, telling you what they want or what they need. Or what they're looking for. Sometimes they're just blatant, like saying, I just need to get a prescription to help with the pain because I'm going crazy, whatever. But a lot of times these people will hop from office to office and they'll get some medicine until that one dries up, and then they'll move on to the next one. So basically, we have to learn how to identify those people as well. And we'll go into that here in just a little bit. But addiction, the term addiction, or somebody saying they're addicted to it, this means the person has become physically dependent on the drug. Meaning, so some people are alcoholics, so they will go into physical withdrawals if they stop getting alcohol or any other drug. But some people become psychologically dependent on it, like just mentally. And it's a strong emotional need because the person starts to crave it mentally, not physically. Those drugs are called habit forming drugs. So there's some that are addiction, but there's some that are just habit forming. Drugs go into two basic categories. There are brand name drugs and there are generic name drugs. When we're writing these on a prescription, the brand names are capitalized. They have trademarks, like Bayer, for example. Okay, Bayer is a brand name medicine or drug. So it's Bayer aspirin, but aspirin is the generic term for it. So generic names are not capitalized. They're unprotected, so there can be many versions of the same medicine, different companies, whatever, and it's less expensive. So, for example, when a new medicine comes out, I think it is, if I remember correctly, for like 10 years, there cannot be a generic form of the medicine. The purpose for that is it forces people to use that medicine so they can earn back the money to pay off for the trials, the formulation, do all that stuff, make a profit on it. And then in 10 years, they can come out with a generic brand when there's no more hold on it anymore. So I thought that was interesting. I didn't know that until, I don't know, 10 years ago or something. But basically it takes time. So there's not all medicines have a generic form, but generic forms are typically very similar in makeup and in their composition, but they are cheaper. It's kind of like buying Equate versus Kellogg's, or I don't know, Equate versus Bath and Body Works. There's the same kind of similarities, but you pay for the brand name. It doesn't always make it better. There will be times as a dental assistant that you'll need to help fill out a prescription. Most times these days it's done on a computer, but not always. Sometimes the doctors still carry actual prescription pads, or sometimes you'll have to type it up on a computer. Or also it'd be great for you to have this information when you are charting. You're going to need to know how to actually write it out. So we're going to go over parts of a prescription. Let me pull up a picture of a prescription pad real quick so we can take a look at that. Okay, so I'm just going to share this real quick while we go over the rest of it, because, oops, I didn't mean to do that. There we go. All right. So the different parts of the prescription here. So legally, prescriptions can only be dispensed by physicians, dentists, and physician assistants, or PAs. You can write it, but the doctor will need to actually sign it and fill it out. Let's see if I can make this bigger. Okay, it's better. See if I can zoom in just a little bit, make it easier to see. Okay. This is not cooperating. There we go. Okay. So on here, we're going to talk about the different parts of the prescription. At the top left-hand corner, it has the DEA number. Top right-hand corner, it has the license. And then it has their information. So a prescription contains information that makes sure that the correct drug is being dispensed in the proper way and the proper quantity. So the heading will include the doctor's name, degree. See, this is the heading right here. So we'll have the name and their degree, the address of their office, the name and address of their office and phone number. Okay, and then in the superscription, just below it, so just below here, there's a blank spot for the patient name, their age, their address, their date. So it'll either have age or date of birth, or sometimes both. So there's a lot of different versions of it, but this is just an example. The body of the prescription will always have an RX. So you can see here it's R with an X over the bottom part of the R. Again, that can be written in many different ways, but the body of the prescription will include this symbol. And this is where the doctor is going to write the inscription and subscription. And those, with that, the inscription and subscription, that means the drug. So for example, if we were going to write amoxicillin, it would say DISP for dispense, amoxicillin 500 milligrams. And then we would write capsules, probably. They usually come in capsules. And then below that, we would write our instructions. Okay, so take one capsule by mouth twice daily as needed, or I'm sorry, for 10 days or whatever it is. And then the doctor will sign it here. So this is obviously the closing portion of it. The doctor's signature, any refill information, you can see here refill 0, 1, 2, 3, 4, 5 or as needed. And then you can check the label, the doctor's signature. And sometimes it'll say any allowances for, that's what the label is. So it'll be generic label or whatever, generic or name brand. And sometimes it'll say allow generic substitute or something. Anyway, all of them are always different, but that's the basics of it. If there's no refill information put down, which there almost always is, they will call and confirm, or they'll just assume that there's none. They will never automatically give refills. There are 2 books that we use for reference in pharmacology. One of them is the Council on Dental Therapeutics, but the other one is the Physician's Desk Reference. Become familiar with what those look like because you'll probably see them through the office. Doctors tend to have to look it up. Let's see, because it's hard to know all the medicines. Physician's Desk Reference is the most common one. I remember seeing this growing up as a kid. It looked like this. The one my mom had actually had like pills on the front of it, I think. I mean, but that one was really old, like from the 80s. I don't remember exactly what year it was from, but I was born in the 80s, so it looked a lot different. But the Physician's Desk Reference, this is it's a great book, but it looks something similar to this. And they might also call this the PDR. We already went over all of that. That's parts of the prescription. In your mod packet, you will find the abbreviations, and you need to study these because you will be tested on them. So the abbreviations for pharmacology. So for example, AC means before meals. Okay. BID is twice daily. So I remember this as B is the second letter of the alphabet, or B means by. So BID twice daily. Caps or capsules. There's 2 of them that always screw with me. GM is gram, but GR is grain. So remember those. Okay. The other one is Q means every. So if you're going to say every 4 hours, it would be Q dot 4 dot H. So every 4 hours. Q dot 4 dot H dot, actually, I believe. So this is in your mod packet. You can study these terms. It's also in this PowerPoint that you have access to as well under the modules tab. So you'll need to study these as well. So this is what it would look like when we are writing a prescription. We'll write amoxicillin 500 milligrams, 1 capsule 3 times a day with meals for 10 days is what this means. Oh, I didn't read the answer. Take 1 capsule 3 times a day after meal or after meals, either way, but it means make sure you have food in your stomach. We're going to have a couple of, let me show you real quick before I move on. We will have a couple of assignments. This is Pharmacology Exercise 1. You do have some papers in your mod packet where you need to write this on a prescription pad. So if you scroll down a little bit, you're going to do 1 and 3. And in here somewhere there they are. You'll need to fill them out on these prescription pads. Okay. So print these out if you haven't already. I think they give you that, like Ms. Rowe prints that off for you, I believe, at the school. Anyway, it's a great practice to learn how to do it. And you can just snap a picture and upload it. So part of your assignment is doing exercise 1 and exercise 3 for these and learning how to fill it out a little bit different. So you can do it by looking at it like this or actually reading what happened and then filling out the prescription. The Pure Food and Drug Act of 1906 was passed in the United States to control and regulate the sale and composition and distribution of drugs. Before this, nothing was monitored. Nothing was controlled or anything. So it was a free for all. It was very dangerous. Anything that you bought was, it was a real problem. So before anything was regulated, like I was saying, it was, really scary. I follow a couple of people on TikTok and on Facebook, and they collect vintage like makeup and stuff. And I really like seeing all the stuff because it was so pretty. The pigments were so beautiful. And it was so interesting to see how they used to make makeups and a lot of other medicines and stuff. And some of them, she's like, oh, I'm not going to swatch this on my skin because we don't know what's in it, basically. It could be lead. It could be, I mean, gosh, I don't know. I found out about some makeup or something that where it actually exposed them to some dyes that were actually very toxic, and they ended up, it was like glow in the dark or something. I don't know. It was crazy. But anyway, thank goodness now we have these regulating agencies that will make sure that whatever it is in what we're buying is safe for us for the, as far as we know. In 1938, I can never say this properly. In 1938, the Pure Food, Drug, and Cosmetic Act was passed. This is for all food, cosmetics, and drugs, anything that's sold in the US. This helps regulate even further. So we've got the Pure Food and Drug Act, but then also the one for cosmetics as well. The Comprehensive Drug Abuse Prevention and Control was passed in 1970. The purpose of this is it identifies or puts all of the drugs or medicines into 5 different schedules of abuse potential. We have to be able to identify those so we can keep people from getting too much or not prescribing the correct medicine for the correct people. You don't want to do any harm to anybody. So it helps to have them in categories. We'll go into those categories here in just a second in the next couple slides. The Food and Drug Administration, they have standards and approve all of the food and drugs as well as cosmetics prior to their sale. So as you know, right now with the FDA just approved Moderna's vaccine, right? We had to wait for that to be approved before we could start giving this to anybody in the United States. So we still have all of these agencies, even in a pandemic, that we have to follow the guidelines for to protect us. The Drug Enforcement Agency, or the DEA, is the one who allows people to prescribe drugs, gives them licenses, and they dispense the controlled substances. I'm sorry, they make sure that the people are dispensing them the controlled substances properly. So they can actually take people's license away. They can penalize people. They can, do a lot of things if like you don't want to mess up with the DEA. You want to make sure you're doing everything properly. So when doctors are prescribing, they have to have a DEA number or they can't prescribe anything for their patients. The controlled substances anyway. So what do these schedules look like, or these drug classifications? The Drug Schedule for Control Act, like we talked about in the previous slide, breaks it down into 5 different, what they call schedules. Schedule 1 drugs have a high potential for abuse, and they're definitely not accepted for any type of medical use at all. So an example of this would be like heroin, cocaine, something like that. There is like literally no medical use, but it is a drug. So we're not treating people with this, but it is something, it is a drug. So that's Schedule 1. Schedule 2 has a high potential for abuse and is accepted, but has an accepted medical use. So an example is like morphine or some of the other controlled substances like that. Schedule 3, these are lower potential for abuse, but they do have a medical use. So something, stimulants, but they can still cause a dependence. These can be refilled up to 5 times in 6 months. Schedule 4 has a less potential for abuse. So for example, anti-anxiety drugs, Xanax, there's still Schedule 4, less potential, but there's still a little bit leery about giving them too much just because we've had so many people try and abuse it. Schedule 5 drugs are just over the counter, like just regular over the counter medicine. So Schedule 1 drugs have a much higher abuse potential and are much more dangerous than Schedule 5 drugs. So which drug schedule does Tylenol with codeine fall under? So it's not just regular Tylenol, it's Tylenol with codeine. And that would be Schedule 3. So dental assistants and the law, that we need to make sure we are following the law. If you want to keep your job, you got to go by the law. You can't just, it's not just a free for all, you know, while it is the dentist license that's on the line. I mean, potentially you could get in trouble as well if you're not doing what you're supposed to do. You'll definitely lose your job. You could probably be fined. But the doctor's really going to come down hard on you if you're not doing what you're supposed to do. So we need to make sure that we are maintaining accurate records. If we are giving prescriptions, we can phone them in or email them directly to the pharmacy. We can give them written as well, but that's kind of going by the wayside. People usually don't want to mess with getting an actual paper prescription. They just want to, can you just call it in for me? We also have to maintain controlled substances if you have any in the office. Sometimes you'll have some that you keep on hand or some that you, like if in the emergency kit, we need to make sure we are notating everything properly and making sure that we're not losing track of anything. The dental assistant is also going to serve as a middle ground between the patient and the pharmacist. So we will do a lot of communicating, especially if you work in like oral surgery or something, you'll do a lot of communicating with the pharmacist. Pharmacokinetics is the stages of drug action. So we take the medicine or the drug, it is absorbed into our system, then our body will distribute it throughout our system. Our body will then metabolize that and use it for what it's intended. And then anything that it doesn't use or anything that's left over, it will then excrete out of our body in some manner, different ways. It can either go through your feces or your urine, or sometimes it'll, you know, it gets out of our body in a lot of different ways. But those are the 4 stages of drug action. There are different ways that we can take drugs. They can go orally, so tablets, capsules, pills, liquids, anything like that, it's considered oral. We have a topical, so this is anything like lotions or gels or foams or creams or anything that's applied to the surface of the skin or the gums is considered a topical. Inhalation is some sort of inhaler. It's a gas or an aerosol that we breathe in to get into our lungs quickly. Anybody that has asthma is aware of these, COPD. There's other types of ailments that will cause you to need an inhalation administration route. Sublingual, again, break the word down. Sublingual, under the tongue. We all know that lingual means tongue now. Hopefully you guys know that. Rectal is obviously in the sphincter, okay? It goes rectally into the anus because it's very vascular and it will absorb very quickly in those areas. We work on the other end, so we don't really have to mess with that. But they might tell you they're taking something rectally for like a suppository or something, whatever, for constipation or whatever it is. So you need to know what that means. Most of the time we deal with sublingual or oral methods of administration. So there are also, if we're going to use injectables, These are the 5 that we will use. Intravenous, again, you can break down the word intravenous, so in the vein, okay? Intramuscular is intra, in the muscle, muscular, muscle, okay? Subcutaneous, okay? Injecting a substance under the skin, so just under the skin. Injecting under the epidermis level is transdermal. I'm sorry, not transdermal, intradermal. Injecting under the epidermis is intradermal. Transdermal is like a patch that you would put on your skin. I forget the one that's first to stop smoking. What's the name of that one? I don't remember. I'm so used to talking to you guys in class. You're not here. Applying a patch of some sort. So for when I had my daughter, they gave me a nitroglycerin patch that I had to put on my chest for it to be absorbed to help with the crazy stuff that was going on with my heart. And that gave me like the most gnarly headaches. It was nuts. But here's an example of it here. This is actually a nitro patch. But this is a transdermal patch here. All right. So staff should be able to recognize the signs and symptoms of anyone who's under the influence of drugs. We need to know, are they high? Did they smoke pot? Are they drunk? Have they taken some sort of, or did they take cocaine? Did they smoke meth? Did they, overdose on this or that? So you need to watch for their body language. Look at their eyes. Are they super dilated? Are they really pinned? Do they seem nervous? If this is the case, then we have to, bring this to the attention of the doctor and let them know, say, hey, this is what I'm noticing. We might need to monitor this person. So we need to know how that plus epinephrine. So if somebody comes in, they smoked meth and their heart rate is up super high, then we obviously don't want to work on them for one. But if we didn't notice it, we need right off the bat, we need to, make sure that we're taking their blood pressure, because then that'll tell us. Because then we don't want to give epinephrine that could make that person's heartbeat speed up even more. Okay. We don't want to raise their heart rate even further. So again, doing our due diligence, knowing the signs and symptoms of anyone that's under the influence of drugs. You do this by taking their vital signs, checking their blood pressure, watching their body language, looking at their eyes. All of these things are going to give you those little subtle cues that we as humans can put the puzzle piece together and figure out. So the term analgesics means to reduce pain without causing the loss of sensation. That means, so that's like ibuprofen or Tylenol. Those are acetaminophen, over-the-counter drugs. Morphine, codeine, prescription-wise anyway, those help, Valium, all of those things help. Those are analgesics. Some of the side effects, unfortunately, with these analgesics can cause some vomiting, nausea, constipation, especially if you have to take them regularly for quite a long time. It can cause breathing difficulties because it tends to slow your respiration rate down. So for example, my mom has what's called pulmonary hypertension, so they will not give her too much pain medicine, which is unfortunate because she has some very severe pain and problems. So she deals with a great amount of pain every single day. But it's dangerous for her to take anything that will slow her respiration rate down. So we have to be aware of that also when we're prescribing medicines. Antibiotics are used regularly in dentistry. We use this to treat infection like an apical abscess, any type of, infection, a fistula has formed or anything like that. We will, when somebody comes in complaining of pain, they'll typically prescribe amoxicillin or something for that. Antibiotics are derived from fungi and molds, and these are definitely manufactured synthetically, but it's something we definitely need. But you don't want to overuse as well, because when you do that, it becomes resistant. Whatever the infection is can become resistant. If you just throw antibiotics at everything, it's going to figure out how to get around it. So there's broad spectrum antibiotics, but there's also very specific antibiotics as well. Your doctor will know which one to prescribe for what. Antibiotics also are ineffective against viral infections, which I'm sure we all need this right. We all know this right now. Obviously, for the virus, you can't give an antibiotic because it won't do anything. It's a viral infection, so it doesn't work like that. Sometimes, like we talked about, it is when it's prescribed to prevent an infection, you can again have side effects for nausea, diarrhea. It can cause a rash of some sort, depending, if you have that. Sometimes it can be anaphylactic. So if someone is allergic to penicillin, even if it's not in their chart, I ask before every single time before I give them any medicine or anything, I'll ask, are you allergic to penicillin? Because that is a huge possibility for an anaphylactic shock, and we don't want that on our hands. Penicillin was the first group of antibiotics to be discovered, and we still use it regularly every single day all over the world. If they are sensitive to penicillin, they can usually, use a different type of penicillin. I think erythromycin is used if someone's allergic to penicillin. So you can still have that option. It's not like you're just out of luck because you're allergic to penicillin. There's other medications that we can use to help with that. They were using tetracycline in the place of penicillin, but they found that tetracycline has some pretty gnarly side effects as well, like the intrinsic staining of the teeth. And some people just have an adverse reaction to it. So they found erythromycin actually works pretty well. The downside to erythromycin, at least when I've taken it before, is it makes my stomach hurt pretty bad. But I guess if it beats the alternative of being sick, it's, temporary. It comes in, erythromycin comes in different forms. So it can be taken, by liquid or a shot or an ointment, a capsule. So it's very versatile. Anticholinergics are, the purpose of these are it reduces secretions from the lungs before surgery. So this is like a pre-med that they might take. Brachycardia is treated with this, and it'll also dilate the eyes for like when you go to the doctor. So it's kind of like a dilator. Anticoagulants prevent the blood from clotting. So baby aspirin, for example, or heparin, all of these things are anticoagulants. So if your patient is taking baby aspirin, for example, and they're going to have an extraction, or there's some other medicines that are also anticoagulants or blood thinners, you're going to want them to stop that a couple of weeks before they come in for their procedure. Otherwise, it can cause a problem or dry socket. But again, your doctor will know that. However, we will need to review the chart. And if when you're doing it and you know it, it might trigger a little light bulb to go off and say, hey, oh, okay, let's ask, are they taking anything that might lead to that? Anticonvulsants are, these suppress seizure activity. So for example, one of the medicines you've probably heard of is Dilantin. Again, this is all name brand examples that they're giving. This can cause gingival hyperplasia, which means overgrowth. So means they have too much. Hyper is too much, plasia is overgrowth. So gingival overgrowth. So if you see somebody and they just have so much gum tissue, so much, you might need to ask, do you take any medicines that might have this side effect? It doesn't always necessarily just mean that everything's infected. It might mean the medicine is causing it to appear this way. Anti-diabetics obviously lower the glucose level. So why am I drawing a blank? Insulin, sorry, drew a complete blank. Antidepressants help, obviously, it says what it does. It helps with depression. So Prozac, Lexapro, those are the two big ones I can think of right now. Antifungal treatments. These obviously treat fungi infections. These come in a lot of different forms: tablets, creams, suppositories, injections. It can cause skin irritation and liver and kidney damage if used long term. but usually you don't need to use antifungal agents for too long. Once you get rid of the fungal infection, it's usually gone. Antihistamine, so this relieves allergy symptoms. So for example, if somebody's having an allergic reaction, it means that your body is releasing too much histamine into their system. So antihistamine means it's going to cancel it out or try and get rid of excessive histamine. Your body had an overabundance of it because it just freaked out when it got something. It just didn't like it. Antihypertensive means it's to lower the blood pressure. So if you have high blood pressure, you're going to take that. Anti-inflammatory obviously reduces pain and inflammation. So ibuprofen, most people don't know this, but it also has some anti-inflammatory, helps with swelling and inflammation. Tylenol does not. So if you're ever wondering, should I give my kid Tylenol or ibuprofen? I always go with ibuprofen because if there is any inflammation that's making them uncomfortable, then it helps. I prefer ibuprofen all the time. We don't even have Tylenol. Well, I'm sorry, I take that back. I do have Tylenol in my house because I couldn't take it while I was pregnant, but I don't ever take it now that I'm not pregnant. I can never say this one, but this word right here, we're going to try it. Antilipidemic. That's a hard one. I probably butchered that. But that one lowers your cholesterol levels. You can also do that with proper diet and exercise, but we're talking about different types of medicines. Antithyroid, self-explanatory. The bronchodilator opens your airways. Contraceptives, I think most of us know what that is, but that's birth control. Decongestants, help with any like sinus pressure or stuff going on in there. A diuretic is what they call a water pill. Helps get rid of any excess water. A lot of people take this if they have high blood pressure as a way to help control it. It helps process any excessive water weight. You can buy like very basic generic ones at like Walgreens or CVS that helps with bloating, especially for us ladies during that time of the month. You can take a water pill that'll help with that feeling. Hemostatic helps blood clotting. So you will use that in the office as well. A hemostatic solution will help for everything to just clot right up really quickly. Hormone replacement, you'll notice this in women who are older. You might see this come across as on their health history. My mom used to take it as like a gel or a cream that you can rub on the arm. It's a topical solution. MAOIs, you've probably heard this on a lot of commercials. These are oxidase inhibitors. So it's taken orally. And nitrates help with the heart. Tranquilizers, they definitely produce a sedative effect. So this is similar to Valium. Sometimes you can prescribe this ahead of a procedure if a patient is aware that they will be struggling with anxiety. So which class might be prescribed to a patient to lower a patient's blood pressure? Obviously antihypertensive, because again, it's not hypertensive, and that refers to the blood pressure or tightness. Nicotine is a stimulant that speeds up the body's activities. Know that. Tobacco is definitely harmful to everybody. Whoever's smoking it, anybody that's around them is secondary smoke. My mom, I think she has COPD. No, wait, what does she have? Her mom smoked when she was growing up. And it's just given her a lot of health issues. It can cause secondary smoke, can cause cancer. Even just, straight smoking can too, but being around it can include cancer or heart disease, any type of oral diseases as well. It can cause periodontal disease. It's no good. Definitely no good. Caffeine is a stimulant as well. It can cause ulcers. It definitely affects the circulatory and nervous system. If you can have too much, it might be fatal. I don't know if you guys have seen, see if I can find this video real quick because it's gnarly. Hang on. Let's see if I can find this because this is nuts. He drank 20 Red Bulls and vodkas, Red Bull and vodkas. And let me see if I can find this video. I'll never forget this. Hang on. That wasn't a very good quality. It's loading. Wait. Hang on. Okay. Sorry, I finally got it to work. What we're seeing here, it says it was debunked, so I'm not sure 100%, but I'm going to show you. They're saying this is something that's called flail chest, which apparently can happen if the rib cage becomes detached from the internal area, like it becomes detached. So one side would be showing this at the other. However, this is not the first video that I've seen of something similar. So I'm just going to show it to you. You guys can take your own preference, but apparently they're just saying 24 energy. Anyway, whatever, 24 energy drinks, guys, it can send your heart into like craziness. So just watch this. They're cleaning it off there so you can, it's really loud. They're cleaning it off there so you can see, but just watch how it just deflates and goes right back up. And I mean, that's nuts, guys. So obviously his heart rate is fairly high. Something crazy is going on regardless of if it's flail chest or not. But anyway, too much of anything is never a good thing. So you don't want to take too much caffeine because it's definitely a stimulant. Your heart is definitely working overtime for sure. Alcohol. There's no useful purpose. Doesn't do anything. Definitely affects our judgment and our dancing capabilities. Slows down reactions. It can cause this, not just of the liver, but I also learned this too that I didn't know. It can cause cancer. Someone who consumes alcohol every single day is at a much higher risk of getting cancer. A good friend of mine was an alcoholic. And it broke my heart because he would call me regularly and he would be down and out or need help with money or, you know, whatever. And I loaned him money a few times, but there got a point where I would say like, you know what? I can't in good conscience continue to give you money. He always paid me back like within a few days, but I can't continue to give you money in good conscience knowing that you're probably just going to go blow it on more alcohol. And he got mad at me once and I told him, I'm sorry. I love you too much to do that. And he was a good friend of mine. I've known him since I was 14. And then I almost called his mom because he was telling me he was bleeding when he was going to the bathroom. He was coughing up blood. And then there came a point where he was homeless. And I was like, your mom is seriously not letting you stay with her. And knowing how hard-headed he was, that's probably not the case. But I was about to call his mom and he sent me, like literally within a few minutes, I was about to call his mom. He sent me a message that said, I'm going to rehab. And I broke down in tears because I was so happy to hear that because he is now 3 months completely sober and he is doing so good. He's not bleeding anymore. He feels amazing. He's like, there is no way I'm touching alcohol ever again because being sober feels so much better. I did not know how bad I got. And a lot of people turned their back on him, just left him to die, I guess. But I was one of the only ones who was still checking on him regularly. I was trying to figure out, like, if he wasn't going to go to rehab and if his mom wasn't going to help, I was literally going to try and figure out in the middle of the pandemic how I was going to get down to Texas to help him, because there's no way I was going to let him die. I wasn't. So alcohol is no joke. You know, and anybody who has probably been around someone who's an alcoholic you can understand that I don't think it's not truly them. I don't feel like it's truly them. It's the alcohol that's taken over. So it's easy to get lost in that kind of stuff, you know, when if you're overwhelmed or stressed out or whatever. So you're going to see alcohol. You'll have people come in the office who will reek of alcohol. And again, you need to alert the doctor, and it'll be their decision if you're going to treat them or not. But most of the time, the doctor will have a very firm conversation and say, listen, I can't treat you if you've been drinking. So marijuana, that's legal here. It can be used to treat cancer symptoms and glaucoma, which was the first, I think the first big treatment breakthrough that they found. Marijuana does increase the heart rate. It can cause lung and tissue damage if it's used a lot every single day over and over and over and over and over again. Can cause some reproductive system disorders. Definitely deteriorates coordination. It slows everything down. And it decreases your ability to think and speak clearly for the most part. I don't think I've ever seen anybody who was 100%. Even though they felt like they weren't. People who were not high around them could tell that they were high. So there's always that underlying thing. It is going to be, even if it's just a fraction of a second slower, you're still going to be able to pick up on it. Cocaine, the medical use has been reduced because it causes physical and psychological dependencies. I think they used to use it a long, long, long time ago. Like a long time ago, fairly regularly. But now it's become way too addictive and way too dangerous. It can cause heart problems, mental disorders, definitely violent behavior, and death, because it once you take it, it's more, and you keep going and you keep going and you keep going, and it becomes very dangerous. And these days, people are cutting it with all kinds of stuff. If you're buying it, I mean, I've watched documentaries. If you're buying it on the street or whatever, well, not that you can get it over the counter, but wherever you're sourcing it from, you have no clue what's in there, and all it takes is a tiny bit of fentanyl to be mixed in with that to kill you. I've seen reports of them putting, I mean, if you guys have never seen it, I would recommend that you look up, I think it was Gordon Ramsay. He saw how cocaine was made. They use gasoline, they use like all this stuff to extract the cocaine from the plant. So it's nuts, guys. You have to just watch that documentary. I highly suggest Googling that, because I think it's like a 10-minute video or something. It's not super long, but I would definitely recommend that. So you'll be able to look at a patient and know pretty quickly if they're on any type of drug. You may not be able to tell exactly what type, but you'll be able to know if they're sober or not. Narcotics are definitely addictive. These are used to relieve pain. So examples are heroin, morphine, and codeine. So people are going to also try and get like codeine from you at the doctor's office, at the dentist, saying, oh, you know, I'm allergic to this, I'm allergic to that, or this doesn't help, or that. If they know specific medications don't work, they're most likely drug seekers. Heroin is an illegal drug, and it is the most addictive of the narcotic drugs. Know this. Heroin is the most addictive of the narcotic drugs. It's said that somebody can become addicted with just one use. It is the most addictive. Some people think cocaine for whatever reason, but heroin is the most addictive. Know that because it's on the test. Amphetamines are a group of stimulant drugs, or uppers is what they are called, referenced to. It increases the heart and respiratory rate and blood pressure. At one point back in the, I think, 80s and even early 90s, it was used to treat obesity. People were prescribing Phenergan? No, that's for nausea. What was it? Phentermine. And I think you can still get it, but it's not as, I think you can still get it in some places, but it's quite addictive. It's bad for your body. It causes a loss of appetite, to be very nervous, very restless. It can treat narcolepsy because people just randomly fall asleep, and ADHD because their body processes things backwards. So it helps calm them down and focus them. Methamphetamines are a strong stimulant. It makes you feel high, a high sense of euphoria, self-esteem, definitely increased libido from what I hear, and heightened alertness. So you're very aware. It's just, you're very, very heightened alerts all over the place. Not worth it. Hallucinogens, LSD, PCP, all of these things. You know, being somewhere where there's a lot of like EDM type music and situations, you're probably going to run into people that, at least I did when I was driving Uber. I could tell these people were high on LSD and everything. I mean, a lot of different medicines. So they're going to come in and they take these things regularly. So we have to be able to identify them. They might start hallucinating. They'll see and hear things that aren't there. They'll be talking to people that aren't there. And it's just their brain creating these images that don't exist. Barbiturates are sedative that depresses the brain activity. So they use these for sleeplessness, anxiety. Some examples of this, there's phenobarbital. We used this, I used to give my cat phenobarbital because he had seizures. She had seizures regularly. Why can't I talk today? Seizures regularly. And so we gave her barbiturates for that. You might prescribe this for somebody with severe anxiety. So which illegal drug has become a big problem in the United States, would you think? Definitely methamphetamine. It's cheap. It's easy to get to come across. People can make it. If anybody, I think that, yeah, Breaking Bad. I mean, that kind of walks you through the whole process of you know, the life and how easy it is to make and how cheap it is to make. So it's definitely interesting. It's unfortunate because it ruins a lot of people's lives, guys. Some herbal and alternative medicines are definitely available. There are quite a few growing holistic dental offices that are happening, but you still have to consult the dentist, caution the patients on using any type of herbal alternative, because a lot of people think that this oil pulling and this and that, I mean, they think it works, but it really, I mean, sometimes it does, but herbal and alternative medicines are not approved by the FDA. So we have to be sure that the effects of whatever it is they're doing, actually, like, it's not based on fact, meaning there hasn't been some sort of trial or anything like that. The preparations are not regulated. So you definitely need to inquire on that more before you start using any type of other herbal and alternative medicines, or before they do. You're going to have, I've heard some people of taking a medicine called arnica for pain. And I have not yet tried it, but they say it's supposed to replace like ibuprofen. I don't know, but it's supposed to be an all completely natural substitute or alternative for it. But again, I haven't looked into it. I don't know if you guys take it, but it would be interesting to research that a little bit more. So anyway, for your lesson, that was the lecture. For the lesson, I want you guys to make sure you're doing exercise 1 and exercise 3 in the mod packet. You can take pictures of your written prescriptions, which is down just a little bit from those, the documents above. Okay, so you just need to do the name, the address, fill all this information out for each one, and you should have plenty of them in your mod packet for that. I would suggest you guys even also doing this page. I don't have a submission for this. This would be an extra, but it says DA120 pharmacology PDR exercise. So you can look this information up in the PDR. And there's also a few extra prescription examples here at the bottom. All right. So I will put this up in announcements. And if you have any questions, you guys can email me or text me or call me, whichever you prefer.